This is going to be, this skill is going to be providing catheter care for a female patient, like cleaning around the catheter. So I would start with entering the room, I would knock, I would introduce myself, I would verify the patient, I would tell her what skill I was doing, so I would be like, well, I heard I need to clean your catheter, or clean around you need assistance with your catheter. And so after that, she verified, she would say yes. I would say, okay, I'm gonna go and wash my hands and gather my supplies. I go wash my hands. I would put gloves on. I would put a barrier down on a table. I then would get 4 towels, a blanket, another barrier or towel or chucks, soap in a bucket, and after I had all those laid out on a table, I would get the bucket and I would fill it up with some semi-warm, or not warm, semi-warm water. I would ask the patient if that water felt warm, if that water was a comfortable temperature. Once they did tell me that, they would, I would place the towels into the water, letting them soak. I would then get one of the chucks, I would roll it up. I would put it under the stuff under the side of the patient. I would ask them to roll over on their opposite side. I would roll it under them. I would make them move towards the middle. I would go on the other side. I asked them to roll over, and then I would roll the chucks completely out under them. Then after that, I would say, okay, we need to put the privacy blanket on you, which I had forgotten to put in the supplies list. We need the privacy blanket. And after that, we put the privacy blanket on. We would roll the normal bed sheet towards the knees area, and we would have the privacy blanket on, and I would inform the patient that I would need to be briefly exposing them, and to tell me if they felt uncomfortable. Then after that, I would drag the privacy blanket and the gown, and I would roll it up towards their stomach area, and then I would get one of the towels out, or I would put the blanket, or not blanket, but towel in between their legs. Then after that, I would get the towel, and I would spray it with the soap, and then I would grab the catheter, and I would apply soap to all 4 leaves of the towel. And after that, I would grab the catheter and I would hold on to it, and then I would clean it like this with all 4 leaves. Then after that, I would get another towel, but not apply any soap to it, and I would rinse the catheter. And then after that, I would get another towel. I would go on the I would clean on one side of the euphoria, and then clean on the other side, and then clean down the middle, clean under-ish, and then after that, I would put that towel away, and then I would get the other one to rinse it. Then I'd rinse all the same sides, and then but I would apply soap, I forgot to say, I would apply soap to all 5 of the leaves, I forgot to say. And then I would rinse all those areas, and then I would get the towel and I would firmly wipe it off. I would firmly wipe it to make sure it was fully dry. Then I would I would put the towel, I would grab the towel and I put it back on the table. I get the the other towel, put that back on the table, and then I would unroll the gown in the privacy blanket, and then sorry, I would ask them, I would unroll it, and then I would I would remove the privacy blanket and put that in the dirty laundry. I would roll the normal the normal blanket back up. Then I would dispose of the dirty towels and the other towel in the laundry, put that in the dirty laundry. Then I would dump out the water from the bucket into the sink. I would wash it and dump that to the sink. I would wipe it out with separate paper towels on the inside and the outside. Then I would put that back in the storage compartment from which it came from with the soap with it. Then I would remove the chucks from the table and put that onto the into the trash can. And after that, I would ask the patient if they needed anything, and if I could get them anything, and I would offer them their call light, say it's right there, call us if you need anything. I would then take off my gloves and pull the curtains patient back. And that would be, I would say, skill complete.